Out here in the western suburbs with our very strict restrictions, the community is kind of feeling very isolated. They're filled with anxiety and worries, and I would go to the extent of saying very depressed.
As COVID spreads through Sydney, 25-year-old Haifa Bakur is starting her day at a pop-up clinic at Lakemba in the city's southwest.
I help with the registration process. I help explain things in Arabic and in English to people. I help reduce the fear that there is around AstraZeneca. We've actually seen people change their minds and agree to take the vaccine that's available to them, and that's been amazing to see.
This week, the clinic reached a record 500 people vaccinated in a day.
I think what's contributing to that type of success is the fact that people feel really at home, feel safe, and having people there to explain the process in their language, I think that's been the biggest difference and why we're seeing so much success at these clinics and maybe not as much in the regular clinical environments.
The outbreak began in June in Bondi in the eastern suburbs, but soon spread southwest into poorer and more ethnically diverse communities. Haifa lives in the hotspot with the highest number of cases and, like many here, has a large family.
My family's kind of a mixed bag. We've got my mum and my dad, I've got my 4 younger siblings, and then I've also got my brother's wife. At the moment, my mum and my dad and my 2 sisters are overseas, and so I've been left in charge of basically running the entire household.
Haifa has her hands full with university and 3 jobs working from home.
When you go into our local grocery store, which is usually bursting with people, you'll find everyone's social distancing, everyone's wearing a mask, people are checking in before they enter the establishments. So to the people who think that our communities are at fault for the increasing numbers or that they're not being compliant with the restrictions and with the rules, I think that is a very damaging message to be spreading.
Hundreds of people with COVID, like Mustafa Murray, are locked down in home quarantine.
Behind me, some toys and stuff for kids because we are doing our best to keep the kids busy.
He tested positive for COVID 3 weeks ago.
Do you want to go out?
Yes.
I started to sort of deteriorate each day, starting from day 1 and getting worse until I reached the peak, which was on day 12.
Mustafa's wife and 2 young children also tested positive.
Muscle ache, coughing, we were coughing blood, and we did have shortness of breath. We did have fatigue, of course, sneezing, headache, everything, pretty much everything.
While Mustafa's been adhering to the COVID safety rules, he believes Delta struck while he was shopping.
Everything like wearing face mask, avoiding touching any surfaces or anything else. I know exactly what I need. So I know I will pick this item from this shelf and that's it. So I did everything, but I got it.
That's your activity, isn't it?
Like many Sydney-siders, Mustafa believed the days of zero COVID would keep rolling. And busy with work and the kids, he thought that getting vaccinated was not urgent.
I told myself it's all right, maybe I will take it later, anytime. Yeah, I regret that, of course. I regret that. I wish I got vaccinated, of course, just to prevent myself and my family from all of these symptoms. I know that it will take long time to come back to normal. Because now in terms of physical activity, it's very hard for me to do any physical activity. So that's why I'm advising all people, to all public, get vaccinated as soon as you can.
Yalla, say bye. Yalla, Lilo. Say bye. Bye.
Some community leaders believe a sense of alienation in the predominantly migrant hotspots has set in. The challenge for health authorities has been communicating a fast-moving and complex pandemic in a clear and simple way.
They feel discriminated, and there's that division that has been created between the West and the East. So that schism seems to, widen day by day.
While the state government stresses it is speaking to community leaders, One major service provider has told 730 it's been left out of the solution.
We do a lot of work on the ground alone. We haven't been involved in any decision making, and I feel that organisations like ours across Sydney could have been part of the solution. We could have had a multicultural task force. We wouldn't be in this situation that we are at the moment if all of us had grouped together. Diverse communities are not dumb. They understand, but they need to get the right message in order to comply.
The message on getting vaccinated seems to be cutting through, but some remain hesitant. Farhad Ali is a scientist at the University of Sydney and has begun research into attitudes towards vaccination in the hotspots.
People want to get vaccinated, they think it's important, but they're worried about aspects of the vaccine. They don't know about long-term side effects. They're worried about things like effects on fertility. The only problem is that they're not being addressed. We don't have public health messaging that really talks to the anxieties that people have.
In a statement to 730, the New South Wales Minister for Multiculturalism said the government had translated thousands of health resources into more than 60 languages and held more than 30 online forums with religious and community leaders. The path now for Sydney seems bleak and an exit unclear.
The aim used to be COVID zero. That's now gone in our view, and the aim has moved. It's now moved to protect the hospitals and give the population of Sydney and of all of New South Wales the time to go and get themselves vaccinated, because that is going to be in the longer term the only way out of this crisis.
It's actually been a very emotionally raw situation because I don't have family to support me at the moment and I can't reach out and go visit family that would usually be there. The potential that the lockdown continues for weeks or even for months is quite scary. And so basically the only thing to do now is to get the population vaccinated.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.